video assisted thoracoscopy. Here you have multiple ports. Through one port you can visualize the anatomical structures. Here you can see the pulmonary vein and the bronchus, and another port you use a lung holding forceps to retract the lung, and through another port you pass the stapler and dissect the vessel and can cut and ligate it. So you need three ports usually, one for the scope, one for the forceps and another one for dissecting the vessels. This video assisted thoracoscopy started in the early 1990s, and this is a less invasive approach than a open thoracotomy. The invasiveness is very minimal when compared to open thoracotomy, and this is the procedure of choice for diagnosis and management of disease of the pleura, non-diagnosed peripheral pulmonary nodules, particularly peripheral pulmonary nodules, and interstitial lung disease. It is well accepted and established operation and become the first choice in lung biopsy, pleurectomies, sympathectomies and various other pulmonary procedure including lobectomy. So, slowly VATS is replacing the open lung surgery concept. Here you can see multiple high definition video screen. So, both anesthesiologist and surgeon can keep up the phase of the surgery. You can exactly know what is happening with lung and various vessels which are dissected by the surgeon, and this facilitates communication between the anesthesiologist and surgeon regarding the progress of the disease. Thoracoscopic lobectomy is usually performed with limited number of ports, maybe 3 ports, and access incision each approximately around 5 cm in length. The advantage, the most important anatomical advantage of using VAT is the ribs are not spread. In open surgery you spread the rib. Here that rib spreading is not required, and it is commonly performed in the lateral decubitus position. But bilateral VATs, such as when you do bilateral wedge resection or a lung volume reduction surgery with VATs, it is performed in the supine position. There is a trend to use only one port for VAT surgery, which is called the uniport VAT. Nowadays, most of the thoracic surgeons are preferring uniport VATs. Uniport VAT may be associated with decreased postoperative pain and shorter length of stay. Coming to the advantage of video assisted thoracoscopic surgery, the hospital length of stay is very minimal. There is very minimal blood loss provided no mishaps happen or a vessel is injured. If no vessel is injured, there is definitely very minimal blood loss when compared to open thoracic surgery. The pain is going to be very minimal, and most important advantage is improvement in pulmonary function when compared to open thoracotomy. Here open thoracotomy, you retract the ribs, you damage some nerves, muscles, everything, and the recovery in pulmonary function will take long time in open when compared to VATS. Early patient mobilization with early recovery and rapid return to daily activities. That is going to be the most important advantage of VATS. And as the surgery is less invasive, your inflammatory reaction is also minimal, and this can be measured by the cytokine response to VATS is very minimal when compared to open surgery.